Healthcare requires decision-making. In adult care, the final authority usually rests with the patient, but this authority depends on one critical ability: the ability to make reasoned determinations in light of conditions, options, outcomes, interests, and values. This ability is what we call decisional capacity. If an adult patient has decisional capacity, their choices should be respected. If they lack it, they are cognitively vulnerable, and protections must be put in place. Thus, understanding capacity is fundamental to ethical medical decision-making. In the United States, we believe adults should make their own medical decisions for two reasons. One, clinical care affects the patient most directly, so their voice matters most. Two, to act autonomously, a person must have the ability to make reasoned decisions. That ability is decisional capacity. In everyday life, we presume that adults do have decisional capacity. The same should be true in healthcare. But not every adult patient does, and when there are identifiable reasons to question capacity, providers must evaluate it carefully. Capacity is the ability to take in information, apply it to one's own situation, reason through it, and make a decision. Further, capacity is decision-specific. Someone may have the capacity for one decision, but not for another. Also, capacity is evaluated on a sliding scale. Higher stakes decisions require a higher bar for capacity. It can be useful to distinguish between capacity and competence. Capacity, being decision-specific, is a clinical determination made by providers. The determination of capacity is recognized in most states' laws as falling under the purview of a medical provider. Competence, which is typically more holistic, is a legal determination made by judges. All adults are presumed legally competent until a court decides otherwise. As a medical determination, medical experts have weighed in on what capacity consists of, and over the last 40 years, 5 characteristics have become standard in evaluating capacity. First is the ability to communicate with others. This can be verbally, or sometimes through even more rudimentary means. Second, understanding. Patients should show that they understand the information that's being provided. Third, this is difficult to evaluate, but it's often called appreciation, that the information and the resulting situations affect the patient uniquely and are not something distant and other from them. Fourth, reasoning through options using their own values and interests in light of the situation. And finally, their choice should remain stable over time. Determining capacity is a clinical skill. Providers should ask open-ended questions, listen for understanding and appreciation, and avoid assumptions. Even patients with brain injuries or mental health conditions may demonstrate capacity for some decisions, if not all of them. Conversely, agreeing with every part of a care plan doesn't automatically mean that capacity is present. Ethically, capacity matters for a couple of different reasons. First, if a patient has capacity, they must be allowed to exercise their autonomy. And relatedly, if capacity is wrongly denied, a patient's autonomy is unjustly taken away. But alternately, if a patient lacks capacity and this goes unrecognized, they risk expressing decisions that don't reflect their wishes and work against their own interests. So you can see then why determinations about a patient's capacity must be reasoned, careful, and fair. If a patient has capacity, the patient retains final say over their care. If they lack it, however, authority shifts to a substitute decision maker. Now, who that is and what responsibilities they carry is not straightforwardly answered. As such, substitute decision making will be left for another video. In this video, we've explored the meaning of decisional capacity, how it is assessed, and why it matters ethically. At its core, capacity protects both autonomy and vulnerability. ensuring that healthcare decisions are grounded in respect for the individual.